Have you been having some unusual symptoms and aren't sure what they mean? In this video, you'll learn how to know if you have hemorrhoids. And if you experience hemorrhoids, then you know just how uncomfortable it can be and how it can affect your life. Fortunately, there are a lot of steps you can take to prevent or treat hemorrhoids. As always, this video is educational and does not constitute medical advice. We are not doctors. Hemorrhoids, also called piles, are swollen veins in your anus and lower rectum, similar to varicose veins. They are enlarged blood vessels that you can get inside or around your anus, the opening of your bottom. Sometimes, the walls of these blood vessels stretch so thin that the veins bulge and get irritated, especially when you open your bowel. Hemorrhoids are one of the most common causes of rectal bleeding. It's completely normal to have blood vessels in your anus, as they play an important role in continence. But hemorrhoids, piles can develop if these blood vessels become enlarged, which can cause symptoms. Nearly 3 out of 4 adults will have hemorrhoids from time to time. There are several types of hemorrhoids. Internal hemorrhoids start inside your anal canal, but they might hang down and come out your anus. They are graded according to whether they come out, and if so, how far they come out. First-degree hemorrhoids may bleed but don't come out of your anus, while second-degree hemorrhoids come out of your anus when you have emptied your bowels but go back inside on their own afterwards. The third-degree hemorrhoids come out of your anus and only go back inside if you physically push them back in. While the fourth-degree hemorrhoids always hang down from your anus and you can't push them back in. They can become very swollen and painful if the blood inside them clots. External hemorrhoids are swellings that develop further down your anal canal, closer to your anus. They can be painful, especially if they have a blood clot in them. It's possible to have both internal and external hemorrhoids at the same time. There are several causes and risk factors of hemorrhoids. You may be more likely to get hemorrhoids if other family members, like your parents, had them. Pressure building up in your lower rectum can affect blood flow and make the veins there swell. That may happen from pushing during bowel movements, straining when you do something that's physically hard, like lifting something heavy, extra weight, like obesity, pregnancy, when your growing uterus presses on your veins, a diet low in fiber, anal sex, if you strain when you go to the toilet, for example if you have constipation or long-lasting diarrhea. Getting older, your anal canal weakens with age, which makes piles more likely. Having a persistent cough. Lifting heavy objects. Hemorrhoids are also common during pregnancy. They may develop due to the higher pressure in your tummy, abdomen when you're pregnant. They usually get better after you give birth. Some people believe there's a link between stress and hemorrhoids, but there's no evidence to support this. But having piles can be potentially stressful. Another theory is that you're more likely to get hemorrhoids around the time of your period. But there's currently no evidence to support this. People who stand or sit for long stretches of time are at greater risk, too. You may get them when you have constipation or diarrhea that doesn't clear up. Coughing, sneezing, and vomiting could make them worse. There are some symptoms of hemorrhoids you should be aware of. Internal hemorrhoids are so far inside your rectum that you can't usually see or feel them. They don't generally hurt because you have few pain-sensing nerves there. Symptoms of internal hemorrhoids include blood on your when you open your bowel, on toilet paper after you wipe, or in the toilet bowl. Tissue that bulges outside your anal opening, prolapse. This may hurt, often when you open your bowel. You might be able to see prolapsed hemorrhoids as moist bumps that are pinker than the surrounding area. These usually go back inside on their own. Even if they don't, they can often be gently pushed back into place. A lump in or around your anus. Slimy discharge of mucus from your anus, which may stain your underwear. Feeling of fullness and discomfort in your anus, or a feeling that your bowels haven't completely emptied after you've gone to the toilet. Itchy or sore skin around your anus. Pain and discomfort after you go to the toilet. These symptoms can vary a lot between individuals. They may also be caused by problems other than piles, such as inflammatory bowel disease, anal cancer, bowel cancer, and an anal fissure, tear. So, if you have any of these symptoms, contact your doctor for an advice. Don't just assume they are caused by hemorrhoids. There is external hemorrhoids as well, which are under the skin around your anus, where there are many more pain-sensing nerves. Symptoms of external hemorrhoids include pain, bleeding, itching, swelling. Hemorrhoids can lead to complications, and rarely it could lead to problems such as skin tags. When the clot in a thrombosed hemorrhoid dissolves, you may have a bit of skin left over, which could get irritated. Anemia. You might lose too much blood if you have a hemorrhoid that lasts a long time and bleeds a lot. Infection. Some external hemorrhoids have sores that get infected. Strangulated hemorrhoid. Muscles can block the blood flow to a prolapsed hemorrhoid. This may be very painful and need surgery. There are many ways hemorrhoids can be prevented. And to prevent hemorrhoid flare-ups, try these steps. Eat fiber. It helps food pass through your system easier. A good way to get it is from plant foods, vegetables, fruits, whole grains, nuts, seeds, beans, and legumes. Aim for 20 to 35 grams of dietary fiber a day. Use fiber supplements. Over-the-counter supplements can help soften stool if you don't get enough fiber from food. Start with a small amount, and slowly use more. Drink water. It will help you avoid hard stools and constipation, so you strain less during bowel movements. Fruits and vegetables, which have fiber, also have water in them. Exercise. Physical activity, like walking a half hour every day, keeps your blood and your bowels moving. Don't wait to go. Use the toilet as soon as you feel the urge. Don't strain during a bowel movement or sit on the toilet for long periods. This puts more pressure on your veins. Keep a healthy weight. Now, you know the symptoms of hemorrhoids, as these symptoms can also indicate a much more serious medical condition. It is best to seek medical attention to ascertain exactly what the cause is. Getting it checked out promptly with your doctor can greatly reduce or even eliminate your pain.